The nasal bones are two small paired bones that are very commonly fractured due to their prominent position on the face. In fact, it's one of the most common fractures you'll see when on facial trauma call. Whenever looking at a CT scan for nasal bone fractures, it's always important to correlate clinically, because many patients will have old nasal bone fractures that may show up on a CT scan and confuse you when doing your interpretation. It's a bit difficult to explain what exactly you're looking at when it comes to CT scan for nasal bones, so right away I'm going to be using multiple views as well as a picture aid to explain what you're seeing. Scrolling up from the maxilla where we last left off, you'll notice the soft tissues of the nose come into play. You'll also notice the maxilla extend upwards towards the nose, and right away you'll see these two suture lines right here. Now, for many of you that are new to CT scans, right away you might see these breaks in the cortex and think, oh, we have fractures here. But this is one of the most common mistakes made when it comes to looking at the nasal bones. These lines bilaterally here are not fractures, but rather suture lines between the maxilla and the nasal bone. This will become more clear later when I show you the picture. Continuing to scroll, you'll once again see another line here that seems to be a break in the cortex superiorly, and it travels all the way down along with the nasal bones. Once again, this is another example of a suture line, or a suture line between the two nasal bones, the internasal suture. Finally, if we go all the way superiorly, we'll see breaks in the cortex here. It's a bit harder to see here, and these represent our junctions between the frontal bone and the nasal bone, or our nasofrontal suture. The reason I'm showing you this is that you need to realize whenever analyzing a CT scan and looking at the nasal bones, these suture lines are absolutely normal and may confuse you as they look like fractures. If we compare with the coronal view, we can see here that these two suture lines are present as well and represent the junction between the nasal bones and the maxilla. In addition, if you trace the suture line running between the nasal bones, you'll see that it runs along the midline and connects the two nasal bones to each other. Let me show you a picture to explain exactly what you're looking at. Here we have a skull with the nasal bones outlined in green. If we zoom in a little bit, you'll see that in between the left and the right nasal bone, we have our internasal suture. Superiorly, between the nasal bone and the frontal bone, we have our frontonasal suture. Finally, laterally, between the maxilla and the nasal bone, we have our nasomaxillary suture. These are the three suture lines that you were seeing previously on the CT scan, and they are normal anatomy. Finally, our sagittal view. It does give us a chance to explore these suture lines again and show you how easy it is to confuse them for fractures. Here we see an example on the left side, and this is between our nasal bone and the frontal process of our maxilla, and this is just a normal suture line. In addition, superiorly, you can see the nasofrontal suture between the nasal bone and the frontal bone, and once again, this is just a normal suture line. As you scroll through the sagittal scan, you're able to look at each nasal bone one at a time from a sagittal point of view, and this will help you get some complementary info on where the bone is fractured and where it is displaced. The most important thing when it comes to nasal bone fractures is to remember your normal anatomy and those normal suture lines and not to confuse them for a new fracture.